Good afternoon. I'm Anita Huberman. I'm CEO of the Surrey Board of Trade. I'm also an honorary captain of the Royal Canadian Navy appointed by Canada's National Defence Minister. Thank you for attending this afternoon Surrey Town Hall with the BC Minister of Mental Health and Addictions, Sheila Malcolmson. I'd like to acknowledge that we are on the traditional territory of the Tsawwassen First Nations and the unceded territory of our Coast Salish people, specifically the Kwantlen, Katzie, and Snuneymuxw First Nations. Ladies and gentlemen, events like this simply do not happen without sponsorship support. Thank you so much to our sponsor this afternoon. Bell Canada is our community sponsor. Their Bell Let's Talk Day initiative had over 150 million interactions in Canada and around the world to help create positive change for people living with mental health issues. Please Google Bell Canada and their Let's Talk Day initiative. And thank you to the Surrey Board of Trade's Business and International Trade Center sponsors, the law firm of Fasken, the Chambers of Commerce Group Insurance Plan represented by SNF Benefits, and BDC, the Business Development Bank of Canada. Joining us this afternoon are some government representatives that I would like to recognize. Representing Tamara Jansen, MP for Cloverdale Langley City, is Shangeline Davidi. The Honourable Bruce Ralston, BC's Minister of Energy, Mines and Petroleum Resources, also MLA for Surrey Whalley. Mike Starchuk, MLA for Surrey Cloverdale. Jagrup Brar, MLA for Surrey Fleetwood. Representing Trevor Halford, MLA for Surrey White Rock, is Effie Cerise. City of Surrey councillors Linda Annis and Brenda Locke, and Adam Duffy, Vice Consul General for the Consulate of Ireland based in Vancouver. Thank you so much for joining us this afternoon. Ladies and gentlemen, just some introductions and opening remarks before I introduce our keynote speaker. All attendees are muted. If you have a question, please put it in the chat function now, and I will get to them. For media, if you have questions, please put them in the chat function, and I will get to them. If I'm unable to get to your question, a response will be sent to you after the session is over by email. Ladies and gentlemen, the Surrey Board of Trade, we're one of the top 10 largest chambers of commerce, boards of trades in our country. There's 450 of us that are supporting business and bringing business into our respective cities. And during the pandemic, we have British Columbia's only rapid response pandemic business center, where we have created Canada's first COVID-19 playbook for business. It's a resource for businesses and your workforce for today and for beyond. We're one of 9 organizations that sit on the Premier's Economic Recovery Task Force. We have a direct line into the Prime Minister's office, identifying gaps and opportunities for each level of government that the business community is facing. We're there for you, ladies and gentlemen, not only today, but into the future. And what's so important to Surrey as we become the largest city in British Columbia by 2030 is to ensure that we're focusing on the livability of our city. Very uncommon for a business organization to focus on social issues, but the Surrey Board of Trade, we've been a leader when it comes to issues from an economic lens, focusing on an economic lens related to poverty reduction, focused on childcare, and focused even on mental health and addictions, because every single person in our city matters. And Minister Malcolmson, her ministry matters. The work that she's doing matters to Surrey. So ladies and gentlemen, it's my pleasure to welcome today's keynote speaker. And as mentioned, she is BC's Minister of Mental Health and Addictions. She was first elected MLA for Nanaimo in 2019. Please help me welcome the Honourable Sheila Malcolmson for her remarks. Sheila, over to you.
Thank you so much, Anita. I really appreciate the warm welcome. I am joining you from the traditional territory of the Algonquin-speaking people, the Songhees and Esquimalt. I'm here in the BC legislature, and I'm really glad to have the chance to connect with the Surrey Board of Trade. Thank you for bringing us together and to have a conversation about such important topics. When chambers of commerce and boards of trade step up and engage in social issues in this way, it says a lot. And I have that experience in my own community of Nanaimo where I serve. I know how powerful it is. So thank you. And no wonder Surrey is the fastest growing city in Canada with such a hospitable group of residents and people who work here. So thank you again for welcoming me here today. And I want to give a shout out to my caucus colleagues, Minister Ralston, MLAs Brar and Starchuk. It's strange not to be able to be together because of COVID, so I'm glad that we're at least engaging together this way. Thanks to the board for the role that it's played through the pandemic, keeping the business community and its leaders and members supported and informed, like the COVID-19 Pandemic Business Center that Anita mentioned, providing that critical information and support for local businesses at such a difficult time has been just vital. To have virtual events be part of that support as well, again, vital. Keeping everybody connected at a time that it's really so possible for everybody to get isolated. And that's always been important to stay connected, but particularly when it comes to mental health. Businesses and workplaces have been hit so hard by the pandemic, and I can only imagine the kind of choices that you've had to make as leaders, having to shut your doors without knowing when they'll be open again, the pain of laying off employees who have in many cases been with you since day one, the stress of scrambling to find new ways to deliver products and services. And at the same time, we've lost some of the tools that help us manage that stress, from seeing live music to playing team sports or dinner out with friends, or just being able to give or receive a simple hug. So early in the pandemic, we saw such a strong increase in demand for mental health supports. It has not slowed. More and more, as people are struggling, more and more people are reaching out for help, which is good. Workplaces play such a crucial role in promoting and maintaining positive mental health, because good psychological health and safety in the workplace aren't just nice to haves, they're critical for workers and for employers alike. And they're essential to a healthy province and a thriving economy. So last week, all of those values led into our province's announcement of a $3 million investment and a launch of, as part of BC's overall economic recovery plan, into a new digital hub, BC's hub for workplace mental health, that will soon grow into an education platform. With an initial focus on some of the sectors that have been hardest hit by the pandemic, tourism, hospitality, and community social services, this hub will play such an important role, providing a range of tools to help address common workplace concerns like harassment, COVID-19 exposure, anxiety, depression. By May, this will have expanded to include Made in BC virtual training and coaching platforms that will provide managers and leaders in these sectors with personalized guidance to help support the long-term well-being of your employees. This is based on the tool that we developed a year ago for long-term care workers, again, built by the sector for the sector. And so we're building on that success with last week's workplace mental health announcement. All of this builds on a foundation that we laid at the beginning of the pandemic. when we devoted $5 million to launching new and expanded online mental health services and providing mental health supports to the frontline caregivers that are experiencing some of the most difficult times of their careers. At the same time, we know how greatly businesses have been and continue to be affected by the pandemic. And we know that the most recent provincial health orders have been particularly difficult for businesses like restaurants, bars, and fitness centers. So to support you through these uncertain times, last week we announced over $50 million for the Circuit Breaker Business Relief Grant Program that will help businesses with expenses like rent, insurance, employee wages, or more. The business gets to decide how you need, and what's the most important. Those are just examples of some of the ways that we're hearing from the businesses that have applied already that they intend to apply. Applications are open now, and the response has been very strong. We estimate 14,000 businesses were affected by last week's circuit breaker new rules, and so the impact is significant. That's about the pandemic, but we know too well that COVID isn't the only challenge that British Columbians are facing right now. Our province is in the grip of two public health emergencies, the other one being the overdose crisis, which tomorrow enters its 6th year of being officially declared a public health emergency. And these crises are not siloed from each other. COVID has been particularly hard on people who use drugs and their families, and Lower Mainland communities have been a visible epicenter. That's had real impact on many of the people who work and live and do business here, and I know that that includes many of you who have joined us today. You've dealt with these challenges with grace and compassion, just like British Columbians throughout the province. And for that, we are truly grateful, because we are going to need to double down on that approach, on that compassion. Before the pandemic, overdose deaths had dropped for the first time in years, but COVID-19 has made everything worse. The supply of illegal street drugs is more toxic than ever before. Combine that with the stigma that drives people to use alone and a pandemic that isolates them even further, and you have a terrible recipe for a surge in overdose deaths, and that's exactly what happened. And we know the people that are suffering are our sons and daughters and neighbors and friends and co-workers. They're your employees and your peers and people that you know. It's devastating, and it has to stop. Now, while there is much more to do, we have done a lot of work in a short period to prevent more tragic overdose deaths. We're separating people from the toxic drug supply. Over 23,000 British Columbians are receiving medications to treat opioid addiction. And we're training registered nurses and psychiatric nurses to prescribe these medications. This is a first in Canada. We've doubled the number of youth treatment beds, and we've added 100 more publicly funded adult treatment and recovery beds. We're working with the federal government to decriminalize the possession of small amounts of controlled substances to help reduce stigma and remove the barriers that prevent people from coming forward and asking for help, treating this as the healthcare challenge that it is. We are opening more overdose prevention and safe consumption sites and distributing more naloxone kits and promoting the use of the Life-Saving Lifeguard app, which is a free app on your phone that automatically connects people who use drugs to first responders if they become unresponsive. So this is a wide array of approaches to a terrible challenge that needs a great diversity of approaches. So we're firing on all cylinders while we continue to build up that system of mental health and addictions care from the ground up. At the same time, I firmly believe that every business and every forum in this province can also play their part by fostering the kind of open conversations that lead to healthier communities. These conversations are vital to reducing the stigma that is attached to drug use. And helping reduce stigma will help save lives. It'll also make us a healthier community. So in closing, I urge you to please talk openly about mental health and addictions with your employees, with your business partners, your community, and please reach out for help if you need it. You can set off a chain reaction of wellness, making it a bit easier for people around you to do the same and to get the help that they need. So as I commit to continue our relentless work until every British Columbian who seeks help and receives it where and when they need it, thank you for your partnership in this important project, and I look forward to the dialogue that will follow. Thank you so much, Anita.
Thank you so much, Minister. Some questions for you, and let's begin with what kind of investments is your ministry making in Surrey?
In Surrey specifically, one of the really encouraging ones has been the new urgent response center that's focused particularly on addictions and mental health. That's the first in British Columbia, and one that is generating results that we're going to see and hopefully mirror in other parts of the province. We've got Surrey's got, I think, at least one new urgent primary care center, which offers 7-day a week immediate mental health and counseling service. That is a benefit in 23 different communities across British Columbia. But the expansion in every single health authority of new beds, of new tools like assertive community treatment teams and new outreach teams that are providing rehabilitation and treatment for people that are not choosing to go into a traditional treatment and recovery home, but medication-assisted treatment for addictions and other supports related to, say, alcoholism that can overcome barriers that might have prevented people from getting to care in the past. People that maybe are shift workers or are have access challenges from daycare or transportation. We're trying to hit this with every diversity of support from the medical community, and so we're finding as many ways of delivering service so that we can meet people where they're at.
What is the government's action plan on, of course, as you mentioned, the second health crisis that we're facing, the opioid crisis? And certainly we're facing significant issues related to that in Surrey. Can you talk about any initiatives that you and your ministry are working on in the development of an action plan as it relates to the opioid crisis?
So the overall plan that was established by my predecessor, Judy Darcy, is the Pathway to Hope. That's the mental health and addictions long-term plan for the province that was informed by so many people that had been affected by family loss and had worked on the front line. It was such a broad community conversation. So that's now Pathway to Hope is locked in. That's our roadmap. And we've been, especially this last year, building it out faster and stronger than we had even anticipated. So 100 new adult treatment beds just added this month, doubling of youth treatment beds, nurse prescribers being able to expand access to medication-assisted treatment, safe supply as a way of separating people from the toxic drug supply. We've had a 400% increase in take-up of safe supply over the last year. Nobody else in Canada is doing any of these things. So British Columbia really has been the sort of the epicenter of innovation and action. New Foundry youth centers across British Columbia. And we know what an impact that has for young people. During the pandemic, because harder for people to gather together, we moved Foundry online. And we found that in particular, young men are more likely to go to the virtual Foundry for their mental health and addictions counseling and group counseling support than they were to go to a physical foundry. And we know in particular, particularly in the Fraser Health Authority region, the number of young men who are dying of overdose and are experiencing mental health challenges that use drugs by themselves and in their homes. The loss of life has been terrible, and so I'm particularly encouraged that young men seem to be more likely to engage with a virtual platform. And establishing rapid access addiction clinics in every health authority across the province has also been important. All part of the plan, tackling this terrible problem, fighting it on all fronts, and all wrapped into the plan that is the Pathway to Hope.
Minister, you talked about safe supply, and I'm just wondering how the BC government is working with local governments to educate them on the value of safe supply centers and partnerships. What work is being done in that regard?
Yeah, there's so much work that's happening right now with the medical community, both to expand the offering of safe supply, to make sure that there is the prescriber guidance around, in Canada, a new way of treating drug addiction, always keeping patient safety at the forefront. So the work is at the same time urgent, but also very careful. It is true that partly, while that work is happening with the addictions medicine community and now with nurse prescribers as well, really important that we all are having the conversations that let people who are struggling with addiction know that this is even a tool that is available for them. So whether they're talking to a nurse practitioner, to their family doctor, to someone at a walk-in clinic, they have to even know to initiate that conversation, because they may not have a healthcare provider necessarily that knows, that has the confidence to be able to talk about this kind of prescription. So it's certainly vital to have local governments be part of that information conveyance, and we are absolutely needing to partner with anybody who wants to work with us to get that word out, and municipalities are such a strong voice. So I can certainly see a safe supply education sort of center and program being something that helps build that continuum of care that British Columbia needs.
One of the other pieces that you mentioned was supports for our youth. The Surrey Board of Trade with the Pacific Community Resources Society were part of the engine creating Surrey's first boundary for youth.
Yeah.
And I just wanted to ask you, as it relates to mental health supports for youth with the pandemic, everything that we've experienced this past year, can you talk about other supports for youth? Like, do you think there needs to be more training, more staff, more clinical counselors, etc., to help our youth?
Yeah, absolutely. And maybe that's the best place to start, is to say thank you to the students that are stepping up and being willing to be trained, both on Vancouver Island and in the Lower Mainland, to have opened up more seats for community mental health workers is something that I'm really proud that we were able to stand up early in this year, in 2021. It's a really good time to go back to school, and especially to be trained in this field. We know that there's a lot of people working on the front line that have been doing the work without a lot of supports, and they're getting a little burned out. So I always encourage when I can let them know about new students coming into the movement. At the same time, expanding Foundry, like building on that really successful model that you've seen work well in Surrey, is really important. There are 11 across BC now. We've committed to expand that to 19. Online virtual support through Foundry, and Foundry's developing an app too, which I've been able to test drive, and it looks like a really great tool. You can actually do your counseling session with Boundary for Youth right on your phone in a secure way. Another really encouraging movement that we have a lot of optimism about getting kind of upstream into the school system and working in a team-based way to not only inside the schools, but with school-age children to identify problems while they're still small and manageable and preventing them from growing into big and possibly lifelong programs. So that's an integrated child and youth team. It's already being piloted in 5 different school districts, but we are very encouraged about the early results and look forward to building on that success and expanding that to other school districts. And then there's also a mental health in schools strategy that embeds mental health and resilience right into the curriculum. Again, this is just early days on it. It's only had I think about 1.5 years, but I am hopeful that we're going to see some more movement on that in the budget that Finance Minister Robinson reveals next week. And then there's Kids Helpline, Here to Talk, and also just announced a year ago, 24/7 virtual counseling support for college and post-secondary students, building on what we've heard from people in post-secondary school of the real pressure that they're under and disconnected from their regular communities and families. So this has been a lifesaver, and I'm so glad that we were able to bring it in before the pandemic really hit hard.
Minister, from Surrey's fire chief, he's asking, are there any plans to provide additional clinical support to priority populations in Surrey? These populations, whether unhoused, housed in temporary or transitional housing, struggling with mental health and addiction, would all benefit from clinical support being provided at their locations as opposed to a hospital setting. Your perspective, please.
Yeah, very true. And this is again an example of where we have a real diversity of supports and because we need to meet people where they're at. By the time that someone's admitted to hospital, they're already in a mental health crisis, and we know that that's very costly for first responders. Very grateful to the service. We know a lot of firefighters are out there dealing with social justice issues that they never imagined, when they first were getting trained, a decade ago. One of the responsibilities that the Premier has given me, in addition to making sure that the supportive housing projects that we are building to get people out of homelessness and give them some stabilization as they move then into a more permanent, affordable housing, is making sure that we do have those full wraparound supports. We know that our health authorities are really taxed right now, particularly with the pandemic and with the increased pressures of homelessness that have happened through the pandemic. We're still building that system out, and we know that there are some times, it certainly happened in my own community, where people that have been, say, evicted from some of that supportive housing because of unmanageable behaviors, some of them are mental health related, that they are really disruptive in communities. So we've kind of got a series of different kinds of work. One is just making sure that those mental health and addiction supports are available where people are at, so that they don't have to go to hospital in crisis. The other is building up more intense supports for those people that have been without care for some time and have a lot of untreated problems that make them difficult to house. And then what the Premier's assigned to me is what we're calling complex care housing. Maybe closer to a long-term care model. We're still working with people on the front lines and with local governments in particular, who have been advocating for this as well. Who is it that needs more care than a supportive housing or affordable housing can give them? Maybe it's people with FASD, maybe it's people with brain injury, maybe it's people with more intense mental health long-term challenges. Hospital's not the right place for them. Sometimes it is, but really if we're talking about dignified housing that provides more mental health support, that's the complex care housing that the Premier's asked me to design. And some of the big city mayors have been very generous about stepping up and saying they want to partner and be part of a pilot project on that can generate some results that other communities can look at with us.
Is Surrey part of that?
I believe so. I don't think that I've met directly with the Surrey mayor on this topic, but the large big city mayors caucus does a lot of cooperative work. Lisa Helps from Victoria is the chair, and I've had lots of good conversations with the Kamloops mayor and Nanaimo mayor, of course. We're still working out the details. I'll say upfront, it's not going to be in next week's budget because we just don't know yet what it is that the communities exactly need us to build. But we are working every week on those conversations to design what it is. We want something that's going to work. We are going to have some new facilities for mental health kind of stabilization and a little bit more of a residential look opening up on the former Riverview lands. We believe this fall. So that will be one new resource on Lower Mainland, but we're determined, and the Premier has asked me to lead building more.
Minister, never before has the topic of mental health and addictions been so prominent than in the pandemic itself. How is your ministry, you've been very leadership oriented, the BC government has, as it relates to creating mental health supports for our business community, for our workforces? Can you talk about some of the initiatives available to businesses to support their workforce?
Yeah. So the two sites that are a particularly good portal right now, the one that was launched a year ago, Caring for Caregivers, designed by and for healthcare workers, particularly with the intention to support long-term care workers who are under such pressure. But others have said, it worked for me. And in fact, you don't even need to be a healthcare worker. There are tools on that site, Caring for Caregivers. Then the one that we launched just last week is I think BC Mental Health Supports. Maybe someone on my team will actually get me the right website. I'm sorry that I don't have it here, but there was a lot of media on it last week. As I said in my introductory comments, it's kind of started as a kind of an initial touch, connecting for individuals with supports, personal exercises that they can do, and then deeper supports. But the next wave, which will come in May, will be more in the line of coaching and support for employers and business owners to support them in their work of modeling and initiating conversations about mental health in the workplace. A survey that was Canada-wide just this past year said the vast majority of people are, of workers are completely unwilling to bring a mental health concern to their employer. And we know what is lost in productivity if people are in the workplace having to take a leave or just not doing their work well because they are preoccupied or they are dealing with intense and very understandable anxiety at a very difficult time. So these, this is our commitment and part of our COVID recovery commitment. We recognize how valuable the resource in the business community and what a portal employers are to reach a great number of people that are under great pressure, especially at this time. But no matter what, we want to come out of the pandemic with a better conversation happening between employers and employees, building on the fact that workers recognize their workplace as a safe place, and something that maybe for this past year has been the most stable place for them. And we want to work with employers so that they can support their employees' mental health and model that action of speaking about addiction and mental health challenges and model that action of reaching out for the help you need.
And many of the links that you spoke of are on the Surrey Board of Trade website, ladies and gentlemen, at businessinsurrey.com on our Pandemic Rapid Response Center portal. And so thank you so much to the BC government and even the Canadian Mental Health Society as well for their great resources. Minister, I wanted to ask you about your work with another ministry within the BC government, the Ministry of Social Development and Poverty Reduction, and how both of you are working on reducing homeless issues. I mean, the downtown east side in Vancouver, there's pockets of that a little bit here in Surrey. Things like that should not be happening in British Columbia. Tell me what we're doing to get ourselves, out of that situation related to, for example, the downtown east side.
Yeah, it's been a real such a visible problem, such a visible expression of our provinces and Canada's failure over time to invest sufficiently in this sector. We have put an unprecedented amount of money over the last 4 years into building new affordable housing, but it doesn't open right away. And as I said earlier, even the modular and supportive housing, as fast as we put it up, it is completely taken up. There is still a waiting line for every kind of housing that we're offering. We know we've got a lot more to do. And the people that have been living on the edge or unhoused for a long time have a lot of unmet physical health and mental health and addiction challenges that mean that it's taking, for some of them, some time to stabilize. And then the pandemic, which has, because of its physical distancing requirements, a lot of homeless shelters had to go to half size. A lot of people that were precarious homeless, couch surfing or bundled up in living in crowded situations, that just wasn't possible anymore. And so it really feels like such a setback that the pandemic has created on the homelessness front. The number of encampments is an expression of that. That last year we were able to decamp 600 people in a number of days from downtown east side and downtown Victoria, 400 and 200, and to do it fairly seamlessly and to get people connected with the supports they needed was a real victory and a real example of cooperation between all three levels of government. And there were people in new tents and new encampments just weeks later. It's the pressure is intense. So right now, by the end of April, we'll have another move from both Vancouver, downtown east side, and Victoria of people out of tent cities and into more permanent housing. Minister Eby is leading that work this time as our housing minister. And as you know, the Premier gives him some of the most challenging files. There's a real commitment across government this time around with our mandate letters pointing to each other about the responsibility of multiple ministries to cooperate on homelessness, mental health, and addiction. So we have a new cabinet committee that David Eby chairs, and I'm the vice chair, on the intersection between mental health, homelessness, and addictions, which again is really trying to break down the silos. We all feel the urgency of this. We all agree that the conditions on the street are unacceptable. We are encouraged by how much we've been able to implement in the 4 years that we've had, but there is so much more to do. So I'm just going to throw just a few numbers on downtown east side. 3,600 supportive housing spaces are funded by the province there now. There are 700 plus rent supplements for people to help them pay rent in more traditional housing. We've opened almost 400 new supportive housing units over the last 3 years in the downtown east side. There are another almost 100 under construction. And we also have a partnership with the City of Vancouver to deliver another 350 new permanent supportive housing units in Vancouver. And that is just what's been committed to so far. It expresses the depth of the need. We know people do better, of course, with a roof over their house, and that's what gives them this, a roof over their head. That's what gives them the stability to be able to access the healthcare supports that can allow them to stabilize and be better neighbors again. But we do not underestimate the impact on communities, in particular the pressure on municipalities. We're grateful to everybody that stepped up in this crisis.
And there is a lot of downloading to local governments as well as a result of the issues related to this and others they're feeling the pressure cost-wise for sure. One of our attendees is a business owner and seasoned professional in both schools, public service, and private practice in the field of mental health. Her concern is that families are obtaining specialized care in private practice and not in public services with restrictive mandates. Why are initiatives only focused on the public service sector, she's asking? Your perspective.
Yeah, you know, this is the work that we're doing to build up that continuum of care on mental health and addiction support, you know, where there wasn't one before, and it is we need a great diversity of approaches. What we've been trying to do is stand up as quickly as we can, access to counseling, access to addictions treatment for people that haven't been able to afford it. What we've heard from a lot of recovery home operators, for example, in Surrey, is you have to be either on social assistance or independently wealthy. And the people in between with a regular working income, they haven't had options. And so that's an example of the new 100 publicly funded beds that we stood up just this month. The counseling question is another example. You know, many people are finding their supports in the private sector and funded through benefits programs in many cases. That is great. We need a diversity of approaches, and people certainly, it's such a personal experience finding a counselor. You know, if people have got options, then great, they can find a system that works for them. Been hearing lately from people the benefits of group counseling. It's much more affordable. It's still led by a well-trained professional, much more affordable, and that the people say that they get a real benefit from hearing other people around the circle, or in this case on Zoom at this time, asking the kind of questions or talking about the sort of issues that they themselves might not have come forward and initiated, that the group is really learning from each other. We have stood up 49 new community counseling programs during the time of COVID. That's a $15 million investment. That's getting a great deal of counseling support to people that would not have otherwise been able to access it. And the work continues with every kind of practitioner, from psychologists down to counselors, you know, being funded in different ways, and people being able to access them in different ways. So there's strength and diversity in this field, and we're continuing to deepen our investments and talk with the healthcare professionals about what they're seeing on the ground and how we can best help.
Another from one of our attendees is, has there been further discussion around significant enhancements to supportive recovery facilities who currently receive 50% less per bed than supportive housing units or shelter beds?
Yeah, so we have bumped up the support that the shelter supplement that people receive who are on social assistance, so that they have got more, they can pay more to be in supportive recovery. We've heard from the operators that that's made a huge difference. It's the first increase in over a decade, long overdue. So that is helping, that we are stepping up and providing more. Some beds that were privately funded in treatment and recovery have now been converted to publicly funded beds. We're doing that kind of about where exactly that goes, we're doing in cooperation with the health authorities. So they're identifying where there is the deepest need. We've made these kind of investments in every health authority, but which facility got chosen for that additional bump up or converting it to a public bed was done in cooperation with the health authority and with the Canadian Mental Health Association of BC. The shelter rate versus the supportive recovery rate isn't something that I've looked at yet. But it may be something that ends up coming to our Cabinet Committee on Homelessness, Mental Health and Addictions, on which Minister Nick Simons, the Social Development and Poverty Reduction Minister, and I will sit. As you know, there's a lot of work happening around social assistance, income assistance levels, and how we support people, whether they're living in shelters, affordable housing, or how we support them through residents at a recovery home. Those conversations continue, and if operators have got particular guidance or suggestions for us, we'd love to hear it. I've been meeting with a lot of the recovery home operators, and there are a lot of them in Surrey. We're very grateful to the public kind of healthcare service that you're providing for many people in the province beyond just Surrey. And they've been very clear with me about some of the barriers and successes that we can model other places. Another piece of work that they've also talked with me about is the Premier's direction to me that we shift the inspection and monitoring of treatment and recovery homes into my ministry, where they can get some more focused attention that would build on the work that my predecessor, Judy Darcy, started. So that's also work that's ahead of us, which will have a big impact on businesses and operators in the Surrey region.
One of our attendees, Minister, it says that it's great to see this as being dealt with as both a drug and mental health issue simultaneously. Could you speak more on not prosecuting small possession charges as part of the approach to deal with this public health crisis?
Yeah, such a good question. So decriminalization is something that the Premier has asked me to pursue. He's asked me to fast track it. To be absolutely clear, because it's not always intuitive when I talk with people about this, our pursuit of decriminalization is to remove the stigma that makes people feel embarrassed about having become addicted or using drugs. And it represents a barrier to them accessing the healthcare treatment that they need. This is not a criminal issue, as long as this is just personal possession. This is a healthcare issue and a social justice issue. So we want the police to focus on prosecuting the drug dealers, and we want people that have fallen into addiction to not face barriers in coming forward and asking for healthcare help. So that's the rationale behind decriminalization. And it's not what the Prime Minister did with marijuana, which was legalization. That's a very different story and a very different remedy. Decriminalization is simply to remove stigma. My colleague, the Public Safety Minister, Mike Farnworth, last year wrote to all the police in British Columbia saying, please stand down on prosecuting small amounts of street drugs, personal possession. We want police to focus on crime, not on addictions. So that signal has been given. The Canadian Association of Police Chiefs has also asked the Prime Minister to decriminalize for the same reason. So we've got quite a strong union, let alone Mum Stop the Harm and some of the other really inspiring family-based organizations that themselves have lost loved ones to overdose. The Premier wrote to the Prime Minister last summer on this. I've been meeting and have written to the Federal Health Minister, Patty Hajdu, on this. We recognize everybody's busy with the pandemic, but we haven't honestly been able to get the federal focus on this question about whether they would consider an exemption from British Columbia to the Federal Controlled Drug and Substances Act. It is a federal area of responsibility that we're continuing to push them on. And we don't really have a lot more options in British Columbia than what Minister Farnworth has already done. But we're going to continue to work with the federal government and hope that they will be able to embark on this project with us. It'll be a first in Canada. We'll be breaking ground again. And we will continue to do all the other work, building new beds, separating people from the toxic supply, building more supervised consumption sites, talking about mental health. Decriminalization is just one step of many that need to work together.
Just two more questions. Thank you for responding to this marathon of questions. Minister Malcolmson, could you expand on your approach to managing the transitions of youth to the adult mental health system, in particular youth who have been in care of MCFD?
Yeah. You know, it's such a complex topic. It's so important, and I don't want to overstate my my work on this yet. I just met yesterday with my counterpart, Minister Mitzi Dean, who's Minister of Children and Family Development. We're talking about this question exactly. And we know that, and there have been some very high profile media stories. I met with two young women along with the Premier just a couple of weeks ago who said, we got really good care in the psychiatric system when we were young. When we became adults, we felt we were treated with great disrespect. We've got work to do. And that, I mean, that will mean that they or their counterparts may be less likely to go to a hospital if they are in a mental health crisis. That's not an outcome that we can afford because these lives are too precious. But I haven't done the work yet to talk about where exactly in the system we need to build up more supports and how we can have that transition work better. It's something that's actively on our commitment list. And I think that maybe once we've had the pandemic wane a little bit, I'm very hopeful that in the months ahead, we'll be able to tackle some of these other systems change problems. Also recognize we can't do everything at once, but I'm very eager to hear from people that have been hands-on about their observations and their solutions in particular. So I'd love to get any advice from people that are working in the field about how to make this system better for young people.
I think it's worth mentioning and concluding with this question where I mentioned the creation of a Surrey foundry right here in our city. And we're excited that it's coming to Surrey, but finding affordable space is such a challenge. You know, affordability, housing, all of that. It remains a significant issue within the Metro Vancouver region. How can the BC government level the playing field so that we can fast track bringing the foundry to Surrey?
Yeah. You know, it is one of the pieces that I know my colleague, the Minister for Municipal Affairs, Josie Osborne, the former mayor of Tofino, has been really working on our municipal counterparts. You know, where can we remove barriers at the local approval process, whether it's for affordable housing, childcare, facility construction, or sometimes the times that neighborhoods say, we don't want to have that supervised consumption site in our backyard. That's an area of conversation that we're having now about how we can better support municipalities in fast tracking the approvals process. The land value question and the cost of purchase and cost of construction is a wicked problem. Because it's a sign of success of the municipality that commercial land and institutionally zoned land is at a premium. You know, in some cases there are some zoning solutions that we can broaden the definition of allowable uses that might make it either kind of less exclusive at the purchase level, that a particular type of zoning of land is less rare, and therefore maybe it's a little, you know, for to site a facility, there are more options available, a larger menu, so to speak. But as well, you know, we lost quite a lot of public land by arguably land that was sold at too low a rate. We lost some of our ability as a provincial government to be able to simply provide land for good social good projects like this. And so it is one of those places that we are having to innovate and find new ways to partner and build the facilities. And who knows what is going to come on the other side of the pandemic, whether we are going to end up with more office space that's available because more people are working from home, whether some of the retail model has changed. I personally think, I mean, this isn't a cabinet project or anything, but I have a personal interest in how we can have that conversation together, the business community and government, about how to, at this time of shift, are we going to have more downtown spaces available that we can look at more affordable housing built into office towers? Are we going to be able to co-locate some of these social services like Foundry and other work that we want to have access to in a way that is constructive and professional, but doesn't trigger neighborhoods about there being a over subscription of social services and supervised consumption sites, for example, that sometimes trigger neighborhoods to say no. I think there's some very important and complex both governance and business conversations that I hope that we'll build on in conversations like this, because we have to learn from each other and do things differently in a way that can meet the social challenges of the day. And with that, I will just thank you so much for the respectful and constructive conversation and the questions from your membership, Anita, and the chance to speak directly with you is a joy. If people do have questions that weren't answered, please do send them to my office and we'll get people. I realized at the beginning, I didn't give a very good list of what is on offer in Surrey, for example, but there are resources out there and we'd love to fill in any gaps on questions that people have. So I look forward to further dialogue and thank you again for inviting me.
Thank you so much, Minister, and thank you to Bell Canada for your sponsorship. Check out our website at businessinsurrey.com for our upcoming events and amazing programs and services to support Surrey's business community. And remember, Surrey is an opportunity city. Thank you so much. Make it a great business day.